Some medical specialists are rejecting the National Health Insurance Bill, saying it is unfeasible. Now, the South African Private Practitioners Forum is also concerned about the sustainability of the private healthcare sector if, as the bill proposes, the role of medical scheme is sharply curtailed. Now, the Forum CEO, Dr. Simon Strachan, joins us this morning. Dr. Strachan, thank you so much for your time. I was just saying, with the National Health Bill, as a consumer that may not be able to afford basic quality health care, it sounds like a good idea. It's also part of the National Development Plan to make sure that the constitutional right of all citizens is access to quality health care. Why is it that you don't agree with it, at least in its current form?
Yeah, good morning. So we certainly do agree with universal access to health care. We certainly agree that that's an absolute necessity. And we are acutely aware as healthcare professionals of the inequalities that exist in the healthcare ecosystem in South Africa. To get excited about the NHI bill is where we start to differ. We are very concerned that the NHI bill will not deliver on promises. So as healthcare providers, we try and stay away from the economics of it and try and stay in our lane. And we try and focus on what is the reality going to be for our patients to access healthcare, and what is the reality going to be for us as healthcare professionals to be able to deliver that care. So let's start there. And remembering that the healthcare system in South Africa, as private providers, we came through the public system. We trained through the public system. We know it well, and we stay very close to it. So as healthcare providers, if you look at specifically Section 33 of the bill, and if you take it to completion, it's going to say that there will be no medical funders. Now, every beating heart that is able to afford medical aid in this country is one beating heart that the state doesn't have to look after. The next part of it is that if you then take away that opportunity, all of those beating hearts are going to have to be looked after by the state. And that's where our concern comes. The bill is very thin on procedure, on access, and I understand that that will be done in regulations. But we think it's completely irresponsible to be pushing through a bill that at its very core is the dismantling of the private sector. Because the pressure that is going to be exerted on state facilities is enormous. And we really believe that patients are going to not find it easier to access healthcare. At its completion, we really believe patients are going to find much longer queues, much longer waiting times. The healthcare professionals delivering that service on the ground are going to have immense workloads. And that is why we think it's irresponsible. And we think that at this time in the country where there are so many other things, as we mentioned, we can go through the crumbling infrastructure. We know the state of public hospitals. We know the state of load shedding, the electricity in this country. To put another something as a burden onto one's daily life, and every facet of what we do affects our health and healthcare. To put another burden on something we have to deal with in daily life, something else we have to think about in terms of how do we make that work, I think is going to put untold strain on healthcare professionals.
You also say that, I beg your pardon, Dr. Strachan, you're also saying that the purchasing model of the National Health Insurance would have an immeasurable negative effect on the fiscus, because now the taxpayers who are already overburdened would have to contribute towards it.
We are saying that, and I think that for us is one of the most logical things to look at and go, how is this going to be funded? Everybody looks at the private sector and says, this percentage of the population has medical aid. Well, the medical aid is paid for out of after-tax income. It's not something that is available in the national fiscus. So if you now are going to take that away and not allow people the opportunity to make those choices and fund themselves, unfortunately, that's where constitutional challenges are going to come. And just the bottom line, and we're not the only people saying this, most stakeholders who have reported on this bill are saying that it's just unaffordable. But the point for us is that there's a journey here. And this is the crux of what we're trying to get across in our statement. And we have made a fairly unambiguous statement. We completely understand that the implementation of universal healthcare and access to quality care is a journey, and it has to start somewhere. But the end result of that journey, what is that horizon? Are we talking 10 years, 15 years, 20 years? And what do we do in the interim? The concern we have is that the NHI bill is deflecting the concentration where it should be placed. It's deflecting the concentration away from re-establishing a good public health service. And we're saying that the private sector is willing and able to participate right now.
All right.
And if the public sector...
I'm afraid we're out of time, Dr. Strachan. Really hate to interrupt you, but thank you indeed for your time. That's Dr. Simon Strachan, the CEO of the South African Private Practitioners Forum, reacting to the National Health Insurance Bill. Parliament is deliberating and debating the bill as we speak.